Presentation of this ViewFinder episode is locally supported by UC Davis Health System.
I've been running since I was 14 years old. I never recall experiencing any pains in my chest or problems while I was running, anything to make me think there was anything going on with my heart. I was 42 years old. I felt a sharp pain. I would describe it as a sharp pain in my chest. I was frightened. It didn't get better, it only got worse, and I felt a little nauseous. It was the pressure right in the center of my chest was getting more severe, and I was starting to also feel a heaviness in my left arm. And luckily my husband was here, and he called an ambulance, and he actually said, I think my wife is having a heart attack.
Heart disease is the #1 killer of women, but it's preventable and treatable. Learn how during this next half hour as we explore the complex heart of a woman.
Hospital emergency rooms. This is where many women with cardiovascular disease eventually end up. Hello, I'm Jennifer Whitney. Every year, more women than men die from cardiovascular disease. The symptoms are very different in women. Sometimes they're misdiagnosed, even ignored. As women, we take our hearts for granted. We love deeply with them, and we tend to put the needs of our husbands, partners, and children first. But now we're going to take a look at why that's not really good for anyone, especially ourselves.
I think I have contributed to people. I've made some impact in lives, and I would like to continue doing that. I can only do that if I'm alive and healthy.
Stockton City Hall was like a second home to Gloria Nomura for many years.
In 1997, I was elected to the City Council.
Gloria was elected to 2 terms, and the last 6 years in office, she served as vice mayor.
When you get elected to a public office, it's 24/7.
Also a continuation high school teacher, Gloria's life was not only busy, but stressful too.
I would be at work at 7, and I'd get off of work by, say, 2 o'clock. And then it's meetings, and then maybe not get done till again at 10 o'clock at night. So I was putting in 14 hours a day, Monday through Friday, and then Saturday and Sunday were also activities.
Gloria took her commitment to the city very seriously. Although she tried to take care of herself, looking back, she says there was a lot she didn't know.
There was a great deal of stress and a great deal of activity. And I had decided to go on a diet, a seafood diet. I wasn't going to eat meat. And it should have been a healthy diet, except I was eating deep-fried seafood.
A diet of fried fast food, lots of stress, and little exercise. Gloria was 60 years old and on the fast track to heart disease.
Eating French fries and drinking Diet Cokes and eating cookies, Oreo cookies, and just, whatever. And I had gone to San Juan Bautista. What happened was my grandniece, who was in the 4th grade at the time, was studying the missions. And her mom could not take her, and her dad said, would you take her to the mission?
It was that day, a few years ago, that Gloria suffered the serious consequences of her lifestyle.
I felt very uncomfortable, like indigestion.
Women tend to have less of the classic heart attack symptoms that men do. Not so much that pressure, heavy pressure elephant sitting on the chest, maybe just more subtle discomfort, maybe not even a pain, but more of a discomfort. Oftentimes more of the associated symptoms, for example, dizziness or nausea or shortness of breath or fatigue doing things.
And I said, well, maybe I'll drink hot tea and go to bed. And as I was lying there, I could feel some numbness in my left arm and just uncomfortable. And so finally I called my daughter. I couldn't believe this was happening to me, and I just felt helpless. I had locked the door and I couldn't even get to that door. I had collapsed right there at the edge of the floor there.
Gloria's daughter and boyfriend frantically banged on the other side of the door.
They had to break a window in order to get to the door. And as her boyfriend carried me out, I think I mentioned to him, I said, I think I'm having a heart attack.
Gloria was rushed to the emergency room, unknowingly bringing with her a roster of risk factors for heart disease. Her age, a family history. Her dad had died of a heart attack. She also had high blood pressure and high cholesterol.
The major risk factors include family history, age. Age over 55 by itself is a risk factor for women, and it's a very important risk factor. The diagnosis of diabetes doubles to triples the risk for women. Depression is also a risk factor for women.
That was Gloria's first heart attack.
I had my stent put in after my first heart attack. And I said, okay, wake up call, I'm cool. I watched my diet and I did do some exercises, but I guess you lapse into your old habits again.
Those old habits led to fatigue and more tests, and during an angiogram, Gloria had her second heart attack.
My heart stopped and they had to bring me back.
A heart attack is when the blood supply to the heart muscle is severely reduced or stopped. If the blood supply is cut off for more than a few minutes, muscle cells suffer permanent injury and die.
Heart disease for many women is hidden, and they may not even know that they have it. They may not have it, but they may be at risk for it, and they need to be aware that they're at risk, that it's the leading killer for women, and that they need to practice prevention.
Bypass surgery, like the operation you're seeing right now, saved Gloria's life.
And I had a quadruple bypass.
We caution you, if you're squeamish, you may want to turn away. This is an actual procedure, and you're looking at a human heart. Bypass surgery is used when arteries are blocked from plaque caused by high cholesterol. Surgeons create an alternate route to restore blood flow to the heart muscle. Blood vessels from the patient's legs and arms are used as grafts.
I was blessed, and that God gave me another opportunity and said, this time you've really got to watch it.
Gloria is now 65, and since the surgery has made dramatic changes in her lifestyle. Gone are the days of deep-fried fast food. Instead, she eats a heart-healthy diet of fruits and vegetables, and she's sticking to it.
It's good to be active, but the activity doesn't have to be the point where it's controlling my life.
She's getting a grip on stress, taking life a little easier, and exercising more. Gloria's blood pressure is down, and so is her cholesterol. The constituents she once served in City Hall are now hearing a new message from her these days. Gloria speaks out about women and heart disease every chance she gets.
I wear red because to me it signifies the go red for women, to raise the awareness of cardiovascular disease among women. I'm a good example.
Wearing red is the symbol for women and heart disease awareness. The red dress links the focus on a woman's outer self to the need to also focus on her inner self, especially her heart.
If we look at the total number of heart disease deaths and compare them to cancer deaths, they are almost twice as many as all cancer deaths combined.
The more risk factors you have, the greater your risk. A woman who smokes is 2 to 6 times more likely to suffer a heart attack than a non-smoking woman. According to the American Heart Association, about 20% of women 18 and older smoke, putting them at increased risk of a heart attack. Kicking the habit is not easy, but well worth it. In the first year after someone stops smoking, the risk of coronary heart disease drops sharply.
There's still no magic pill and no magic bullet. It's the good old-fashioned lifestyle changes. We call them therapeutic life changes because they really are the treatment for prevention of development of heart disease and prevention of worsening of established heart disease.
New breakthrough medications combined with diet and exercise are helping to lower blood pressure and cholesterol. Taking an aspirin a day as a blood thinner is also beneficial, but it's not for all women.
An aspirin a day is recommended for men. For women, you really need to have a risk assessment and determine at what risk category you are. An aspirin a day is recommended for all women that have established heart disease and for most diabetics because diabetes is a heart disease risk equivalent.
A woman's heart is a muscle that keeps her alive. Gentle and beautiful like a red rose, it needs to be properly fed and cared for.
A woman's heart is a precious organ from which flows love, but also needs nurturing to keep beating.
That means it's imperative for women to know their numbers, what their blood pressure is, and their cholesterol.
I have my cholesterol levels checked every time my intern medicine doctor wanted me to have it done. I had it done, and I have it done regularly, at least 4 or 5 times a year or more.
Good cholesterol numbers for women are higher than they are for men. So the good cholesterol should be 50 or higher ideally for women, whereas for men it's 40. And the bad cholesterol should ideally be 100 or less.
75-year-old Dorothy M. Navy lives in Sacramento. She walks her tree-lined streets regularly and takes good care of herself. She's had high cholesterol but has been managing it with medication. As for her blood pressure,
I was diagnosed with high blood pressure one time in my life.
She's always felt healthy. So when she was out of town at her niece's wedding, Dorothy was startled when she began experiencing what she thought was persistent indigestion.
I had a little heartburn. I thought that's what it was.
But when it didn't go away, an ambulance was called.
The guy walks in, he says, "Who's the patient?" I say, "I'm the patient." He said, "You don't look like you're sick." I say, "I'm not sick, I'm just having heartburn. I don't know what's wrong."
Then at the hospital, the doctor told her something she couldn't believe.
He said, "Well, you look great." He said, "But Miss Navy, you're right in the middle of having a heart attack." I said, "Oh no, I'm not." He said, "Yes, ma'am."
I was speechless. She was visiting out of town, and having the distance in between us, I just felt like I needed to get to her immediately. And it was a shock to all of us. No way has she had a heart attack.
Dorothy's daughter, Marilyn Harrison, says she's grateful every day that her mom is okay.
Without her, I don't even want to think of our lives without her.
Dorothy had 5 stents inserted into her arteries. A stent is a wire mesh tube used to prop open an artery. Before a stent procedure, doctors take a close look at the arteries and veins through a variety of imaging techniques, including MRI and angiogram. In the case of an angiogram, the doctor inserts a tiny tube into the artery through a small nick in the skin. An X-ray dye is injected to make the blood vessels visible.
It really makes you sit back and be thankful for life, for knowing something about your body that has gone wrong and that you wasn't quite sure what it was.
Dorothy says she likes staying busy and is taking computer classes. Since her heart attack, she watches what she eats, has lost weight, and exercises regularly.
My kids tell me I do too much, but I don't pay them no attention. I just go right on. As long as I feel good, I'm fine, and I feel good. If I get tired, I know when to stop, and I just take me a nap, sit down and look at TV, and I fall asleep.
Watching their mom, now Dorothy's children are taking heed of the unusual warning signs of heart disease in women. 51-year-old Marilyn is paying close attention, and for good reason.
I am absolutely at risk. We all are in our family. We've all made some big changes as far as, sugars and butters and fats and frying versus broiling.
61-year-old Maria Tapia has also given up fatty foods, and she comes here to the UC Davis Cardiac Rehab Center in Sacramento 3 times a week.
This has been helping me to get a strong heart. When I start here, I can hardly walk.
Maria had bypass surgery, and her cardiologist, Dr. Amparo Villablanca, got her into rehab as soon as possible.
I get stronger. My heart gets stronger, and I'm losing around 30 pounds.
Maria began having heart problems when she was 35 and has been taking medication ever since. 10 years later, she developed diabetes.
It's hard when you have diabetes. It's hard for your heart. And because the sugar make a lot of struggles in your body. And we have to be careful with that. And when you control it, it's better for your system.
Shirley Long has also been living with heart disease since she was 35.
At 35, I started with chest pain. By 36, I had an angiogram and they said that I had a blockage. At 56, I was on 12 different medications for high blood pressure, diabetes, heart. I didn't know what to do. I wasn't feeling good about who I was not a happy person. The psychology department really helped me a lot to determine that I needed to take more time for me as a mom, as a wife.
Remember, depression itself is a risk factor for heart disease.
Depression is added now in the American Heart Association guidelines for screening for all women as a preventative measure because it's both associated with higher risk for developing heart disease and also higher risk of dying from heart disease once a woman has the diagnosis.
When their stress level goes down, so does their stress hormones in their body, the cortisol level, the adrenalines. And with the lowering of those stress hormones, the risk factors improve.
Shirley works out regularly these days, eats well, and is learning to take more time for herself. And she's feeling better.
Now I have more than hope. I want to help other women understand you can do it. All you have to do is want to do it, and it's there for you. It's okay. It's really okay to take care of yourself. You've done it for everyone else, now take the time for you. It's okay.
Heart disease, in some ways, is about choice. Doctors say eating a healthy diet of fresh vegetables, fruits, and fish can make all the difference in the world. Well-known chef Lena Fatt is working with the American Heart Association in Sacramento to let women know healthy eating can also taste good.
This is mahi-mahi fillet, and what I'm doing is I'm going to steam the mahi-mahi, and this is really, not only is healthy, but tasty. And
Dr. Diane Sokovich is a Sutter cardiologist and Go Red spokesperson for the American Heart Association. This type of fish is an excellent source of fish oil.
What the fish oil does is it increases the good cholesterol, it smooths out the arteries, and they've also shown that it decreases the risk of dying from a heart attack by about 60%.
For that thick of fish, may take about 5 minutes. I do make a sauce for that, and the sauce has a tiny little bit of oil in there, and I use olive oil. So
the good oil, which again increases the good cholesterol in your system.
Add a little soy sauce, sugar or sugar substitute, a splash of sesame oil for flavor, and, of course, garlic.
And garlic does have antioxidants. It is heart healthy.
The sauce will be lightly drizzled over the steamed fish.
Just a little bit lightly to flavor it, and then you don't have to worry about eating too much salt, let's say if you have high blood pressure, or even if you're watching your blood pressure, which most of us should be. You have high heat, so this way the green beans don't absorb the fat.
The fish will be served with fresh green beans cooked in a little bit of olive oil. Add some brown chicken breast to the green beans.
This dish, I don't have to use any salt. The reason why is because my flavoring is the dried olive and also dried turnip, and they are preserved with salt.
Then, some brown rice garnished with toasted sesame seeds.
Brown rice has so much more nutrient than the regular white rice.
And there it is, a heart-healthy meal that's good for you and at the same time, delicious.
It's wonderful.
Thank you.
Eating right and exercising gives women the upper hand when it comes to heart disease. But it's not a guarantee, especially since women's symptoms are not what anyone expects. 44-year-old Diane Wurm is a perfect example.
I wouldn't call myself a marathon runner, but I am training for a marathon right now, actually with a group of friends.
Diane's been running since she was a teenager and has completed 3 marathons. These days,
I run 6 days a week. Helps me relax, relieve stress, and keep physically fit.
She was the picture of health, or so she thought. While out running one morning, Diane experienced an unusual chest pain.
Not enough to make me keel over, but enough to make me stop running and go, whoa, what is that? I did initially think that it was acid. And it was a burning, but somewhat of a pressure. It didn't get better, it only got worse, and I felt a little nauseous.
Diane managed to get home, and her husband immediately called an ambulance. She was rushed to the emergency room where she was diagnosed with having a heart attack. She was just 42.
What was going through my head was, is this it? Is this my life? This really wasn't what I had planned. It makes me a little emotional even now, just thinking about it.
Just breathe normally.
At first, Diane's symptoms were misleading. She didn't have high blood pressure, high cholesterol, or diabetes. She never smoked, ate well, and worked out.
They did actually say, we really don't think this is a cardiac issue because you have no risk factors.
I wouldn't call her necessarily standard, but a lot of women present like her. A lot of women have to go to emergency room twice before they are diagnosed with heart disease. Their symptoms are just not typical. They themselves don't think that they might have heart disease, especially in Diane.
Dr. Marjan Fariba is Diane's cardiologist at Kaiser Hospital in Sacramento.
We look back and see the studies that have been done have been all about men, how they present with heart disease, and what symptoms they have, and what happens after they have heart attacks. As physicians, we are also biased, and we don't look at her as someone who could have heart disease. And so it's easy not to order certain tests or not to think about it. And if you don't think about it, you don't look for it, you don't find it.
Diane had 2 arteries that were 100% blocked.
Each of those have 2 stents that they put in.
She encourages women to advocate for themselves if they suspect a heart problem.
Again, I thought, I'm not at risk. This can't be a heart attack. Obviously, I know something's wrong, but it's not a heart attack. So when the doctor did tell me you have a heart attack, I about freaked out. I felt flabbergasted, totally taken by surprise. Really, and at that point, they gave me some more drugs that totally did knock me out.
Pay attention to see if there's any stress anywhere. Through our rehab program, we have created a meditation program for patients like Diane, who has had a heart attack or angioplasty or bypass surgery, some heart event. And we've created a meditation program which involves breathing exercises, meditation, concentration, meditative movements. We teach them techniques to lower their stress level.
I got lucky and I survived the heart attack where everybody isn't so lucky, and I feel blessed for the fact that I did survive. And I'm just thankful.
As for running again, well,
I'll admit I was a little paranoid. I was frightened that, well, I mean, my thought was, I thought I was healthy before, and I went out for a run and look what happened. Initially, I actually just ran around the block. I increased it each day. I got up to like running 5 miles.
Now she's training for a marathon.
I don't want to stop my life. And again, the running, it makes me feel good about myself. It gives me confidence in my abilities. It's a great feeling just to be out there and not have to think about anything or worry about anything. You're just out there on the trail. Sometimes I do look around and just check out the world and make myself aware of the place that we live in. Sometimes I focus on my breath, you know, it's just like in, out, just thinking of, okay, this is me, this is the moment that I am alive right now in this world. I'm glad that I'm here to experience it.
To order a DVD copy of this program, call 888-814-3923 or visit kvie.org/viewfinder.
Presentation of this ViewFinder episode is locally supported by UC Davis Health System.